Now, muscles of the pelvis. The muscles of the pelvis are obturator internus, piriformis, levator ani, and coccygeus. Obturator internus, it is a thick fan-shaped muscle that covers most of the lateral wall of the pelvis. It arises from the obturator membrane, margins of the obturator foramen, and pelvic surface of the ilium between the obturator foramen and greater sciatic notch. Its fibers converge posterior-inferiorly to form a strong tendon that hooks around the lesser sciatic notch and crosses the posterior aspect of the hip joint to be inserted onto the medial surface of greater trochanter. Now another muscle is the piriformis. It is a triangular muscle, one on either side of the front of the posterior wall of true pelvis. It arises from the pelvic surface of the middle three pieces of the sacrum by three digitations. Its fibers converge inferolaterally, pass through the greater sciatic foramen notch to enter the gluteal region, where they form a rounded tendon which is inserted into the tip of the greater trochanter. Now another important muscle which is very important in relation to the pelvis is the levator ani muscle. This is the levator ani muscle. The two levator ani muscle are wide curved thin sheets of muscles. They slope from side walls of the pelvis towards the median plane. This is the right levator ani, this is the left levator ani, where they fuse in the median plane to form a gutter-like floor of the true pelvis and separates this true pelvis from the ischiorectal fossa. Now origin of the levator ani. It has a linear origin from the pelvic surface of the pubis bone, tendinous arch of the obturator fascia, and pelvic surface of the ischial spine. After taking origin, the fibers sweep backwards, downwards, medially. The anterior fibers form a sling around the prostate that is known as levator prostati, or vagina that is known as levator vaginae, sphincter vaginae, and are inserted into the perineal body. That is the mass of fibrous tissue in front of the anal canal. So this part of levator ani is known as levator prostati in males or sphincter vaginae in females. The intermediate fibers that are known as puborectalis form a sling around the anorectal junction to be inserted into the anococcygeal raphe. This anococcygeal raphe is a fibrous raphe which extends from the anorectal junction to the tip of the coccyx. Now posterior fiber, these middle intermediate fibers are known as puborectalis. Now posterior fibers, which are known as iliococcygeus, are inserted into the anococcygeal raphe and the coccyx. This levator ani muscle, it is supplied by the perineal branch of the fourth sacral nerve and the perineal branch of the pudendal nerve. The levator ani muscles of the two sides together support the pelvic viscera and resist the intra-abdominal pressure during straining and expulsive efforts of the anterior abdominal muscles. Another important function is they subserve a sphincteric action on the anorectal junction to maintain the continence of feces in both sexes and the continence of vagina in the female. Another muscle is the coccygeus muscle, that is also known as ischio-coccygeus. It is a small triangular muscle situated behind the levator ani. It arises by its apex. It arises by its apex from the pelvic surface of the ischial spine and sacrospinous ligament, and from its base it inserts into the sides of the upper two pieces of coccyx and the last piece of the sacrum. So it is supplied by the ventral rami of fourth and fifth sacral nerves. The coccygeus muscle the coccygeus muscle assists the levator ani muscle to support the pelvic viscera. They also produce minor movements of the coccyx. Now it must be clear to you the pelvic diaphragm. This pelvic diaphragm is a muscular partition between the true pelvis and the perineum. This hole is the pelvic diaphragm. It forms a gutter-shaped pelvic floor. It is formed by the large levator ani and coccygeus muscle of the two sides and their covering fascia. It is incomplete anteriorly to allow passage of urethra in males and urethra and vagina in females. The pelvic diaphragm provides principal support to the pelvic viscera and has a sphincteric action on the rectum and vagina. It also assists in increasing the intra-abdominal pressure during defecation, micturition, and parturition. The openings of the pelvic diaphragm are hiatus urogenitalis. It is a triangular gap between the anterior fibers of the two levator ani muscles, that is the anterior fibers of the sphincter vaginae or levator prostatae. It transmits the urethra in the male and urethra and vagina in female. The hiatus urogenitalis is closed from below by the urogenital diaphragm. So it must be clear to you that the urogenital diaphragm is different and pelvic diaphragm is different. Another hiatus is the hiatus rectalis. It is a round opening between the perineal body and the anococcygeal raphe. It provides passage to the anorectal junction. Now, sometimes there may be injury to the pelvic diaphragm by tearing of the perineal body during difficult childbirth. As a result, this pelvic diaphragm becomes weak and no longer provides sufficient support to the pelvic viscera. This may lead to uterine lapse, uterine prolapse, and rectal prolapse. Now, on a pelvic fascia. The pelvic fascia is present in the form of two layers, parietal layer and visceral layer. Parietal layer is the continuation of the fascia transversalis of the anterior abdominal wall. In the pelvis, it is termed by different names. First is the obturator fascia. It is a well-defined layer of fascia that covers the obturator internus muscle. It presents a linear thickening called tendinous arch, which provides origin to the levator ani muscle. Another is the fascia covering the piriformis muscle. It is a thin layer of fascia covering the piriformis. The sacral plexus lies between the piriformis muscle and the fascia which covers the piriformis muscle. Now vessels of the pelvis. The vessels of the pelvis are superior rectal artery, internal iliac artery, median sacral artery and ovarian artery. We will discuss the internal iliac artery. It is a smaller terminal branch of the common iliac artery. It passes downwards in the pelvis to the upper margin of the greater sciatic foramen, where it divides into anterior and posterior divisions. Now further, the anterior and posterior divisions give branches. Now branches from the anterior division. First branch is the superior vesical artery. It is a persistent proximal part of the umbilical artery in fetus. It runs forwards and medially to supply the upper part of the urinary bladder. It is crossed by the ductus deferens and often gives branch to it. Another branch is the obturator artery. It passes forwards along the lateral pelvic lateral wall, along the obturator nerve, and leaves the pelvis through the obturator canal. Another is the inferior vesical artery, that is also known as vaginal artery in the female. It runs forwards to the base of the urinary bladder. It supplies the base of the urinary bladder, prostate and seminal vesicles in males. It also gives a branch to the vas deferens. Another branch is the middle rectal artery. It is a small branch which passes medially to the rectum. Another branch is the internal pudendal artery. This is the internal pudendal artery. It is the principal artery of the perineum. It leaves the pelvis through the greater sciatic notch, greater sciatic foramen, and passes over the posterior surface of ischial spine and re-enters the perineum through the lesser sciatic foramen. Another branch is the inferior gluteal artery. This inferior gluteal artery, it is the largest branch of the anterior division of the internal iliac artery. It is the largest branch. It passes posterior-inferiorly between the ventral rami of S1 and S2 to enter the gluteal region through the greater sciatic foramen. Another branch of the anterior division of internal iliac artery is the uterine artery. It runs medially on the floor of the pelvis along the root of the broad ligament. It ascends upwards along the lateral margin of the uterus, then runs along the uterine tube to terminate by anastomosing with the ovarian artery. Another is the vaginal artery, as already discussed to you that inferior vesical artery is also known as vaginal artery in females. It supplies the vagina and the base of the bladder. So these were the branches of the anterior division of the internal iliac artery. So these are the superior vesical artery, obturator artery, inferior vesical artery, middle rectal artery, internal pudendal artery, inferior gluteal artery, uterine artery, and vaginal artery, that is also known as inferior vesical artery. Now branches from the posterior division. So this is the posterior division. There are three branches from the posterior division: iliolumbar artery, superior gluteal artery, and the lateral sacral arteries. Iliolumbar artery ascends upwards along the sacroiliac joint behind the external iliac vessels, where it divides into lumbar and iliac branches. Lateral sacral arteries are usually two, upper and lower. They run downwards and medially over the sacral nerves. Their branches enter the sacral canal through anterior sacral foramina to supply its contents. Another is the superior gluteal artery. It first passes backwards between the lumbosacral trunk and ventral ramus of S1, then leaves the pelvis through the greater sciatic foramen along with the superior gluteal vessel. So these were the branches of the posterior division. I will summarize. Posterior division gives three branches: iliolumbar artery, lateral sacral arteries, and superior gluteal artery.